Over-the-counter medicine. I want to pause here for a second. Over-the-counter medicines might seem trivial, but these medicines are powerful. Knowing which medicines to take and how to do so safely isn't common knowledge. I ask my patients in the ER what medicines they've taken at home for their symptoms. Usually the answer is nothing, but if they did take something, it's typically significantly underdosed. I ask not to bother people. I ask so I know what medicines I can still give safely. Let me walk you through my approach, and hopefully there's something you can use to help yourself and maybe help others. I typically start with acetaminophen and diphenhydramine for a few reasons. First, they're very safe. Both are designated Category B by the FDA. This is a pretty exclusive category amongst medicines. It means that no overt evidence exists showing harm to pregnant moms or their baby. The second reason, their side effect profile. Acetaminophen has very little, if any, side effects. It does not cause drowsiness or an upset stomach. Diphenhydramine, on the other hand, has the known effect of causing drowsiness/inducing sleep. In this case, if you have the time to sleep, I recommend taking both. Remember, rest is a part of the foundation of headache treatment. So, use the diphenhydramine to help you fall asleep while the acetaminophen works to take the headache away. Using different medicines to achieve a common goal is termed synergy. The third reason, they're inexpensive and widely available. So, how much acetaminophen can you take safely? In the hospital, I use 50 milligrams per kilogram of ideal body weight. But in the interest of keeping things simple, let's assume you're healthy and don't take many medicines. If you weigh between 75 to 150 pounds, take 500 milligrams of acetaminophen. If you weigh more than 150 pounds, take 1,000 milligrams of acetaminophen. It takes 1 hour to work and lasts about 6 hours. Then it wears off. If your headache persists, it can be safely repeated 3 times in 1 day for up to 3 days. The danger with acetaminophen is liver damage and potential liver failure. The upper limit for 1 day is 4,000 milligrams. The regimen I'm recommending is well below that threshold. People typically run into 2 issues. First is accidental subacute overdose. The second is intentional overdose. Accidental subacute overdose. That's a mouthful to say, but if you break it down, it makes a lot of sense. Subacute denotes a timeline of days to weeks. The classic case is an older patient with arthritis and other chronic medical problems. They're prescribed a number of different medicines, not knowing some of them already contain acetaminophen. Acetaminophen's effect on the liver is cumulative over time. So if you're taking it more than 3 days in a row, you run the risk of liver injury even if you remain below the 4,000 milligram threshold. For a 1 or 2 day headache, the dosing I'm recommending isn't an issue. In an effort at risk reduction, the FDA mandated combination medicines containing acetaminophen to restrict their acetaminophen content to 325 milligrams. The second issue is intentional overdose. Acetaminophen, when taken in massive doses, is lethal. The worst part, it is a slow, painful death. If you're going through something, seek help. Liver failure is a horrible illness. It's terrible for people with cirrhosis, cancer, hepatitis, fatty liver disease, but it's even worse in acute overdose. I've seen it a number of times. Never be afraid to seek help. Don't suffer in silence. Despite the gravity of what I'm mentioning to you, unless you're allergic to acetaminophen or have pre-existing serious liver issues, acetaminophen is exceptionally safe.